So we're about to have a consultation with this gentleman for a revision rhinoplasty. So he underwent septal rhinoplasty 2 times in the last 4 years, right? And this was in various of the different Indian cities. He's also had derma fillers 1.5 years back, and his medical history is otherwise fine. He's a trainer by profession. And so this is the kind of the issue that he has. So he's got a collapse here. He has issue with his breathing as well. His tip is over projected, if you can see, and it's also pointy and not having the right shape. There's a break in the dorsal aesthetic lines, so it's broad on top, it's broad there. It's not like the aesthetic lines are all wavy, and the tip is over projected. If you look from the side, the show of the nose is less. So we're going to do a few things for him. It's going to involve around the dorsum, around the upper lateral cartilage, around the lower lateral cartilage, the tip plasty. And I don't like this angle. It's not the usual kind of angle, the nasal septal angle. So I'm going to work on that. This shape of the columella is also going to be changed. Probably will require some marginal grafts and alar baton grafts to give support for the weak alar complex. And that's also in the cards. And I've also taken consent for rib harvest, because revision rhinoplasties are always challenging. This is a tertiary revision rhinoplasty, and so I got to be prepared to, sort out any eventualities. And sometimes for the lack of support in the septum or in the tip or in other needs of the spreader grafts, very often a rib will be needed. So that's the plan. I'm expecting this to take a little over 2 hours because it's a challenging revision case. We're hoping to do this afternoon.
Yeah.
Right, he's fasting since morning. You have any major concerns or queries that you haven't already asked me?
I don't really have any major concerns.
All done?
All done, yeah.
Okay.
I just hope doctor does it, and I truly believe that doctor is going to do it for me. So yeah.
Yeah, me too. I mean, like I said, there's nothing like a perfect nose. There's always a good scope for improvement, and that's something what I'm going to do for you. A good improvement, maybe 80% thereabouts. I mean, you can always find with my post-operative results and say, there's still something. But on the whole, I think we're going to give you a much more balanced nose.
Yeah.
And do remember, it's challenging for me as well when we're doing tertiary and many revision rhinoplasties. And so you be little less, what shall I say, detrimental or less prudent judging the final result. But I think the result will definitely be better.
Yeah.
Otherwise, I wouldn't take you up for surgery. All right? So thank you. And I think we'll follow you up.
Yeah.
Yeah.